For millennia, what we call depression and other mental distress have been seen by traditional Chinese medicine, aka TCM, as problems of energy flow interruption, and hence the use of systems like acupuncture to treat them through stimulating energy flow. As these methods gain scientific validation, we see them integrated more and more into Western medicine, with acupuncture even being used by the US Air Force for battlefield pain management. But what is the body's energy flow as understood by TCM? Does it overlap with the energy our cells produce from food? What would cause this energy flow to be disrupted to bring depression and mental distress? And what can be done energetically and even on a deeper emotional level to get things moving again? Today I welcome back Dr. Jingduan Yang to lend his wisdom to these and other questions of energy and mental health. Dr. Yang is a psychiatrist and integrative medicine doctor who combines Western medicine and holistic medicine. He also represents the 5th generation of his family line to practice TCM. Welcome to Vital Signs, where we learn how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendon Fallon. Dr. Yang, fantastic to have you join us on Vital Signs again.
Thank you for having me, Brendon.
One of the main reasons I wanted to ask you on, Dr. Yang, is a comment you made about how important the energetic aspect is to our mental health. And I know you look at health from this 4-dimensional model of biochemical, structural, energetic, and spiritual. But for starters, I'm interested to know a snapshot of where the energetic aspect fits in to this 4-dimensional model that you have.
Thank you for the question. And if we really think about what depression is or what depression manifests, we can look at, decreased interests and have lack of the ability to feel the pleasure, and then the fatigue and the lack of concentration and change of appetite and trouble with sleep, and have some passive or active suicidal thoughts, and feeling shame and guilty and blaming self, and so on and so forth. If you look at all these symptoms, they are manifestation of problem with either thoughts or feelings or physical activities. And this is all really manifestation of energy. And the thoughts are energies, the feeling emotions are energies, and the physical behaviors and energy levels. So they're really a problem to begin with, is manifest as energetic level. So when we are facing energetic problems, we have to understand that from the energetic level. Of course, the modern medicine started, relatively new, and it started by understanding human anatomy and the body structure, which is great, which is important that we understand how the human body is made of and materialistically. And the second is about chemistry. So we began to understand a lot of nuance of the biochemical ingredients and the biochemical process and what involved in the biochemical balance. And that's where we understand that now the psychiatry almost like therapy-wise downgraded from understanding it from the spiritual and energetic level to the biochemical level. And now we prescribe a medication that disrupts the biochemical process to generate artificial effects to make people feel different, and which works for some people. But in the long run, the chronic use of biochemical intervention that is caused by energetic problems and even spiritual problems, and will not going to give us long-term benefits.
It's kind of a Band-Aid solution for many people.
Yes, Band-Aid solution, and also it can cause new problems. So this is why we need to understand it from energetic level. And there's a new book by professor at Harvard and who studied from the modern medical perspective about energy and the brain. And he concluded it's all about the mitochondria dysfunction. It's interesting because not many people understand what mitochondria is. It's actually almost like an independent cell inside the human cell. And its ability, it's really where all the nutrients and chemistry and process happens, where they can produce the energy for the cell to survive, for the tissue to function, and and to generate life forces. So in the way, the Chinese concept of qi, which is the description of different form of energy in the body, is almost like very closely equivalent to the energy that produced in our mitochondria. So in the way, mitochondrial dysfunction will cause problems in almost every health issues, because if it's involved in the neurons or nerve cells, then it's caused trouble with nerve system. If it happens in the heart or in the gut or in the muscles or in the liver, and it will cause other problems. And so it is interesting to see how we further understand the function of mitochondria, and also communication of mitochondria with each other inside the cells, and between cells, and between tissues and organs, because that understanding will lead to what the Chinese medicine called energetic channels or meridian systems.
So this is kind of like the convergence point, you might say, Dr. Yang, between the metabolic energy that's produced in the mitochondria and this idea from traditional Chinese medicine of energy flow, like the qi energy, I guess. I'm interested to know more about that, where these two things come together.
Yeah. So since this is where we're looking at things from the biochemical perspective, but if we take the traditional Chinese medicine fundamentally as a medicine for human energetics, then we began to see some interesting connections that we were not paying attention to. First of all, in Chinese medicine, there's qi is just energy, but it has a different kinds, depends on where the energy coming from. For example, it's coming from your parents. That means we inherited it, and that's something to do with our constitution and with our genetics, right? So same thing. The modern medicine understand the disease, and it has a genetic components to it. And then it has something to do with environments. So that's environmental factors from very young age or time the life was conceived began to play a role, affecting how the genetics express and transform. And so that's modern medicine called epigenetics, right? And then we have things coming from the food and coming from the air, and so we call them postnatal energy, that is really support our daily activities and so on and so forth. So those, and then the energy in the brain and in the heart, in the gut, in the kidney, in the different places, give the set different name. Basically, they're the energy support the heart, support the spleen, support the liver, support the kidney, and supports lung. However, it's interesting, as much as we think the brain is so important, it is, and nobody will dispute that. But brain is not one of the major energy center or organ system. It's considered as extraordinary organ. It is an organ in the way it is special, and also in the way it is supported by the rest of organ systems. So that means that when we are generally speaking about energy, and actually the brain energy is connected with the energy of every internal organ system in the body. Therefore, energetically, we will see some special connections between specific emotions and specific brain function, and that will manifest in the different form of depression.
That's very interesting, Dr. Yang. I think many people just have the impression there is this qi energy and it's the same. There's just this one type of energy that is circulating in the body. So it's interesting to hear that there are these different types depending on the origin and where in the body it's located. Could you say a little bit about, because I know with acupuncture, for example, this can stimulate the flow of energy. Can you say a little bit about how energy might change or how it might move from one place to the other? Is energy regularly circulating from one part of the body to the other? And what kind of effect does this bring?
I think energy starts from the energetic centers, which we call organ systems. So anatomically and chemically, that's, for example, liver or gallbladder. But energetically, they are the center of a energetic network we call meridians or energy channels. They're invisible. They're just the energy itself is invisible. Just like electrophysiological activities, we have to use machine to measure them, like EKGs and EEGs, right? So they do exist, and just like air, they do exist. It does exist, but you don't see it. But you can't live without it. Same thing with the human energy inside the body. And so this network has its own system of circulating. And take a liver gallbladder example. It's not just in your abdomen, like it's structurally kind of connected, but through the blood vessels, through the nerve system, it does connect with the rest of the body. So that's modern medicine recognized. But energetically, it has a lot more comprehensive connections. For example, it's connected with the occipital brain areas and eyes. So totally connected with your visual system. And therefore, so anything disrupt the liver gallbladder energy will affect your visuals. And anything to do with visual issues, like when people have migraines, they have auras, right? When people have vertigos, they see all the things moving. And so anything involves vision has something to do with your liver gallbladder. And it's connected, it circulates through the neck and occipital, the neck and the shoulder, and then the parietal area and the frontal area. So, and the temporal area too. And then that cause, for example, people have migraine headaches, have neck shoulder pains, and it has a lot to do with energetic issues. And it's also connected with a part of the brain, almost like prefrontal lobe, where you regulate your mood, you communicate, and you initiate, and you make decisions, and develop strategies or plan or take actions. So it all this executive function and has something to do with the liver gallbladder energies. And of course, the sleep, the regular sleep, particularly with the dreams. And that's also the energy as dependent on how well your liver gallbladder is doing energetically. And also it goes through everywhere in the body, from the heart, from the chest to the abdomen to the bladder. It's responsible for regulating their movements, their functionality. So therefore, when you have liver gallbladder issues, it might cause you have heart palpitations, chest pain, or even heart attack, and affects your stomach, cause reflux, bloating, and the gas. And then for the bladder, it cause impotence, cause a trouble with urination, either incontinence or have difficulty urinating. And all this function seemingly unrelated to the liver gallbladder, but now you see it's related. And all the 6 organ system, they all circulate among themselves. They also connect with others to support each other. So you have generally 5 major organ energetic system to support each other and also to balance each other.
Yeah, hence the value with traditional Chinese medicine of looking at these systems all together, as opposed to the way Western medicine tends to compartmentalize these different aspects of the body. And you touched on a little bit the mood center of the brain, I think the prefrontal cortex perhaps, and you spoke about sleep, the aspect of the brain that influences sleep. So these are important to mental health. What could happen that could influence energy flow to affect these areas and bring about mental health problems?
Well, energy is important because without it, we're not living. But energy also is problem itself. It's very sensitive. You consume it. When you generate energy, you also generate waste, and that's something modern medicine recognize, oxidative stress, chronic inflammations, and all that. And the second is that it's very easily to be blocked. If you want to block blood circulation, you really have to do something drastically to do that. But to block energetic flow, it just takes a emotional reaction or stress, and it will block it. And so this is, and also it can move. It has to move in the right direction, and it can easily moving in the wrong direction. And then you constantly consume it, deplete it. Eventually, you're going to lose it. Okay, so when we are done with energy, then that means we are dead. And even you have a body, even you may have the same chemistry, but without energy, you're just dead. Okay, so this is a kind of energetic problem. So to give you example, because it's relevant to how important that emotional distress is a powerful energetic attack. So I always say, if you want to attack somebody physically, you have to touch them. If you want to damage somebody's structural body, you have to touch them. And when you're trying to hurt somebody chemically, you have to poison them. But if you want to attack somebody energetically, you just need to say something mean, or give them a dirty look, or raise your voice. That's it. And that person will be hurt and energetically, because it will block the energy flow. And that depends on what negative emotion was triggered. It will cause different blockage of energy circulation. For example, if it triggered anger, resentment, frustration, it caused the trouble with the liver and gallbladder system. I just gave you a long list of examples of what could happen. But if you look at these symptoms, it's a common modern conditions. We give them names like migraines, fibromyalgia, chronic fatigue, GERD, irritable bowel syndrome, depression, and all this kind of arthritis or chronic pain. So if it generates the worry and bad feelings about yourself, it's going to affect your spleen, stomach energetically, and make you obsessed, make you worried, make you having trouble thinking clearly, make you have trouble with digestions, with metabolism, and cause feeling heavy in the body, and has trouble build or maintain the muscles, and so on and so forth. So emotionally make them, mentally make them obsessed and have low self-esteem. And if you look at this is another form of depression, when people just feel bad about themselves. They're not necessarily angry or resentful, or they just feel bad. They're just constantly feeling, having low self-esteem, low self-worthless. So these are kind of issues. But if you generate fear, on the other hand, it will cause trouble with your kidney bladder, and which is responsible for memory, concentration, willpower, and reproductivity, sexual functions, ability to maintain the bone health, and the movements, agilities, and the control of sexual functions, control of bladder and the bowels. So again, you trigger another set of physical and mental behavioral health issues. And if it's triggered sadness, grief, and loss, and the people will have all kinds of skin issues, body hair issues, respiratory issues, allergies, seasonal allergies, bronchitis, and constipation, feeling stuck, and physically, emotionally. So this is another set of, um, how the emotional distress will um, block the energy flows. Another one is very common, is when people feel confused, feel lost of direction in life, and or feeling vulnerable and feeling lack of meaning and a purpose. It affects their heart and affects their consciousness, affects their small intestines, which is important metabolic organs and where you absorb nutrients.
When you say consciousness, Dr. Yang, you mean that their ability to focus?
Or the ability to think clearly and ability to making a mindful and thoughtful decisions, or thinking with a clear head. And they also have trouble with the other circulation, the heart functions, the small intestine functions. So these are the example of, so therefore we say there is a 5 types of, just biochemically, there is a 5 types of biochemical imbalance for depression. And energetically, there are 5 types of energetic depression imbalance. The imbalance that mostly affecting the heart and small intestines, and the one affecting the lungs and large intestines. The one affects the liver, gallbladder. The one affects the spleen and stomach, and the one affects the kidney and the bladder. They all manifest slightly differently, but they all share the similar symptoms. We just generalize them as depression.
It's really fascinating, the energy connection to these different emotional problems. I've always felt like the relationships are so critical to I think when we talk about spirituality, the way that we do relationships is really core to that. And interesting what you were saying about this confused state where there's a loss of meaning, loss of purpose, how this manifests with heart conditions. I wonder, and I'm probably getting a little philosophical here, if something like, as you mentioned, kind of like an emotional attack, if someone says something mean to you or gives you a bad look, this can bring about a kind of energy blockage. Does it work the other way as well? If you're able to, in some way, free this blockage, encourage a better energy flow, is this going to improve your relationships, do you think?
Yes. The emotional, we all talk about stress, or do you have a stressful job? Or do you have a stressful life? And actually, stress is our physiological, emotional, and behavioral reaction to what is happening, right? And how do we react depends on how we perceive what is happening, right? If we perceive what is happening is a very bad thing, okay, then you feel terrible about it, right? If you perceive it as a neutral, then you probably have less reaction to it. If you perceive it as a positive, and you may have a positive reaction to it, right? So it's really determined is how you perceive and interpret what is happening. You're talking about relationship, how you understand the people around you. How do you really relate to each other? And what kind of relationship you really have with each other, or your relationship with yourself. And people always say, what are you talking about? What do you mean your relationship with yourself? Because we tend to confuse our spirit with our body. So that's what I meant. So your spirit with your own body, that's your relationship. And then your relationship with the higher powers, because fundamentally, the relationship we're talking about is a relationship between spirit, between souls. That's the word we're talking about. So therefore, how you understand all these relationships, and then you determine how you understand what happening between two people, why people that does something or say something or do something to you. How do you understand it? Anyway, so that kind of tied to somebody's value system and belief system, right? So that affects the how you respond or react. So therefore, yes, if you have a belief system or value system or philosophical system or life system, whatever you call it, philosophy, that you can look at everything, everybody around you in the positive way, or at least in the neutral way, you will have less emotional distress. So the stress is you can't control what is happening, but we do have a control how we look at it and how we react to it, right? So that's where the system called life cultivation kicks in, and to teach us how to believe, what to believe, and what to think, how to react to what's going on happens in life, particularly in the challenging situations when somebody taking advantage of you, somebody humiliating you, somebody cheating you, and so on and so forth, or even physically, financially hurting you. And those are the situations where truly testing how you understand your relationship with people and what you should do under those circumstances. And that's why this some of the techniques that today's people use, for example, mindfulness-based meditation, you know, and so much study had demonstrated the healing power of it. But if you look at what it is really derived from the Buddhist practice, where the compassion was fundamental core values, and where you treat every adversary events from human perspective as an opportunity to refine and improve your capability of tolerance or being compassionate. I think it's similar to other culture and spiritual practice. Some of them become more religious practice, but overall, there are very common theme in the spiritual practice of all cultures that address us to help us to look at things in a positive way, and that we will not develop the negative and the emotional distress, and consequently there's a behavioral reaction to it which can be detrimental to ourselves. I remember I learned this cliche some times ago, but actually it's pretty effective when you say that to remind people, is that the anger is a poison that you drink and hope somebody else is going to die. Because
so true.
if you let somebody make you angry, you already gave them power to hurt you. And the angry you are, and you're hurting yourself, and it doesn't hurt anybody else. So anyway, so this is some kind of way that remind us how we could generate positive emotions and look at things positively. I think that's why there was a positive psychology as a therapy, a lot of inspirational speech and speakers trying to encourage people to be positive. I think there's a energetic foundation for it, and consequently, there's a biochemical results from it.
Yeah, and I think if someone is treating you poorly, it takes, you mentioned mindfulness. I think this kinds of things like meditation, they might help you have that space to look at someone's negative behavior toward you in a bigger picture context, and maybe have some understanding of why they might be behaving that way, what kind of things they may be struggling with that is influencing their behavior toward you. I wonder, Dr. Yang, if you have any examples that come to mind where you've helped someone dealing with a mental health problem, maybe depression, where there's been a specific focus on the energy side of things?
Well, there are so many, almost every patient's coming into my clinic, and we look at them in all four dimensions. They're not just a symptom or diagnosis. They're walking as a complete integral a physical body, right? We want to look at it. We want any damage to the body part as microscopic as the level of subcellular level, like membranes cells. And we look at them biochemically, not only about what they're missing in nutrients, but mostly what's wrong with the biochemical process that utilize nutrients and generates the biochemical products like neurotransmitters, hormones, cytokines, and so on and so forth. And we definitely look at them energetically, not using modern medicine. We measure vital signs, we do EKGs, EEGs, EMGs, all the Gs that's necessary to measure the electrophysiological things. But we also utilize Chinese medical energetic system to evaluate their internal energetic balance and conditions. And fundamentally, we are just recognize everything we're looking at is just the body parts. And it's just like a car, we're trying to fix the car, and the body parts, the chemistry, the energy. But we're not really looking at the key part, which is the driver of the car, is the soul of the human being. So I think the most important that we need to understand the soul of human beings. So when we look at this way, and our treatments is very different. I'll give you an example. There's a gentleman, middle-aged, very, very famous chef, and working very hard, and suddenly developed the Bell's palsy. And
this is where one side of the face droops.
Yeah,
right?
Bell's palsy, where you have the damage to your seventh facial nerve system. You cannot close one of your eyes, and your face was moving to one side. You cannot drink, you cannot talk properly, and because all that's all like a waking up call, and I brought him to my office, As a neurologist, I was a neurologist for many years. We saw many of these conditions. And we just said, okay, well, this might be the virus causing it. And let's just give you some antiviral medicine. And we also know there will not much can be done, rest, this and that. But
this is usually a temporary condition, right? Bell's palsy.
Well, the usually kind of depends on what is the cause of it, and some people fully recover, some people don't, some people take a long time. So this is but this patient's coming, and then we began to realize he has extremely high blood pressure, and to the level of he can have stroke anytime. And then we identify he had been very, very irritable, agitated all the time. He had very tough relationship with people around him. He easily lose temperament. He will curse and he will yell, scream, And so he's not happy, and he's emotionally troubled, and all that. And of course, even he has a very strong face. He just feels himself not being able to control and practice his face. But it's good that he has a face, so at least he knows what he's supposed to do, and what he want to do. But it just emotionally, physiologically, he couldn't practice.
Be compassionate, be understanding.
Yeah. So how do we treat him? And first of all, we start with psychoenergetic therapy, where we really works on his emotional status, and how we desensitize him from reacting to a situation where he would be triggered and become angry, because that can be very dangerous. And in Chinese, we have to say, you're so angry, your face got twisted. It's literally like that, what he experienced. So we have to work on that from the psychoenergetic level, from spiritual level, and we have to understand what are you living, what life you're living, how you look at all these things, why you're losing temper so easily, why you're so angry at other people's mistake and you're punishing yourself, so to speak. I think that word's stuck in his head, that, you drink the poison, hope somebody else is going to die. And he said, no, I'm not going to drink poison anymore. When somebody gets something wrong, I'm not going to drink the poison for them and hurting myself. So it's kind of things like that. So we have to address those issues. And he's someone who really have a strong face. He wants to be compassionate. He wants to be tolerant. He doesn't want to be angry. So actually, he's not happy with his own behaviors and his feelings. And then we were using the acupuncture Chinese medicine and energetically to help his conditions. And at the time, I also was introduced him to hydrogen molecular therapy. I just discovered in Taiwan, and I found it was extensively used in Japan, which is a very strong antioxidant and the hydrogen molecule is smallest molecule in the universe. And you're breathing it, and you go to the brain and go to nerves, go to the mitochondria, clear up the selectively clear up the bad free radicals and reduce inflammations, oxidative stress, which he had. And that put him to sleep, and he wasn't able to sleep, and he was able to sleep at night. The first week he began to use it.
Right.
And so we changed his diet, and we encouraged him to continue his meditation practice, which he had ignored for quite a while. And he used to do that, but, and so again, after a year, he did a very extensive treatment for 3 months, and I don't see him again. He back to work, and I don't see him. A year later, I saw him. I couldn't tell. He looked like 10 years younger.
Wow.
And you can't tell he had never had the Bell's palsy. And the people around him say he's a much nicer person to be around.
Wonderful. What a result.
This is someone, it's a Bell's palsy, is a waking up call, but it leads to a transformation when you address all these issues in the multiple dimensions. And fundamentally, health is starting from the soul, but medicine starts from the problem, the sickness.
Yeah.
So he's an example. We are transform him from the dealing with the sickness and to self-care to address his health. So he's a great example of what we do with people.
Yeah, that is a very compelling example and really illustrating how all these dimensions of health come together and how looking at them all can achieve a very powerful outcome. Just on the Chinese medicine side, Dr. Yang, you mentioned that some acupuncture was used. Could you say a little bit more specifically about that side that was used in this man's case?
The major problem when I explain to people about doing this, doing that, yes, as a technique is, if you're anxious, tap here, people say, why, or you press here and help morning sickness of a pregnant woman, or help with heart palpitations, you press here, reduce your toothaches and all that. So, but I think people need to understand what exactly it's all about, And if you want to understand the Chinese medicine, learn what to do. And it's not just trying to learn a couple of simple tricks, which we love that, right? In the show, and the people just want the simple tricks. But simple tricks is not simple. And if you don't understand what's behind it, number one, you may not use it, even you know it. And number two, and you're limited by what you know. But if you know why, then you can really utilize fully and for multiple conditions, and you can really help yourself. So from now on, if you think about Chinese medicine, you have to think about you're wearing a quantum glasses, and you bypass your bodies, your skin, your bones, your muscles. All you see is your entire energetic existence. Almost like if you are from the airplane, you're looking down, flying at night, you see how the city was like. You only see the lights. You don't see anything else, right? So then you find that your organs is shining and have a different colors and have a different network as it's all moving in certain directions, all that. But they do have a opening in the surface of the body, like windows and doors, okay? And we call them acupuncture point. In other words, these windows and doors are connected into all this organ system. So all these energetic system have its own openings on the body. Why? Because the human energy need to interact with energy around us through these points. So we call them acupuncture points, okay? So therefore, by the pressure or stimulate certain points, you can influence the balance internally and to achieve self-healing or achieve medical care. So that's the way you understand it. Therefore, the different points connect with different internal organs connect with different parts of the body and the brain, and are responsible for different physical, emotional functions, right? So therefore, this is the understanding of it. So but to do that, you have to first understand what kind of energetic imbalance you have. I said there's 5 types, right? So that's the number one. And sometimes it's more than one, right? But maybe majority is your liver, gallbladder, but your spleen stomach is affected, and your large intestine is also affected. So you got 3 systems involved. Then you need to develop the herbal remedies to do that. You need to develop the way to address different emotional distress and the worries, angers, and sadness. And then you develop the meditation, breathing techniques, and acupressure system or acupuncture treatment plan for it. But if you ask me for one simple, quick de-stress technique, and it's actually is coming from a technique called the neuro-emotional technique, and Dr. Monty, who has the Dr. Monty show, teaches, and also I believe that Dr. Scott was the one that formulated it. So it's a simple way based on Chinese medicine. You press all I don't know if I can show it, and the pulses, and on the one side, and you press it, you cover your forehead, and you connect with all the emotional distress, and you take a deep breath until those feelings dissipate. And you need to do both sides, both sides. That's so maybe we should have some illustration for people or
Sure. Yeah.
for that. I wrote it in my book. But this is, you just do each side for 2 minutes. You can do several times a day or whenever you feel stressed, and you do. So I do that sometime. I wake up in the middle of the night, and I would do that to put me back to sleep.
Wow.
Or whenever I feel like I'm kind of worked up a little bit, I feel myself not calm, not peaceful, and I do that just to calm myself down. It definitely, like many other breathing technique, it activates your parasympathetic system, and it's calm down, your overdriven sympathetic activities. So that can be helpful.
We'll hear more from Dr. Yang in just a moment, but first, here's a look at my talk with integrative psychiatrist Dr. Daniel Monti on the neuro-emotional technique. More and more research points to this as an effective way to relieve unresolved stress and trauma.
People go into a fight or flight survival mode when those unresolved events get kicked up or triggered. And this puts the body in fight or flight a lot of the time then. When that's the case, that it has far-reaching effects in the body, in the brain, and in one's quality of life.
There is little doubt state of mind has a powerful effect over the health of the body.
The neuroemotional technique is looking at emotions and cognitions, but also the body's energy system. Bringing together what the person's perceptions are, the internal dialogue that's going on, all at the same time can really lead to some dramatic results, and that I have seen time and time again.
Afterward, find the link to that video at the top of the comments and also in this video's description below. And if you're finding this video helpful, please be sure to share it with family and friends by clicking the share arrow below. You have a new show starting with Epoch Times, a kind of class that you're delivering. Do you want to speak a little bit about that, Dr. Yang?
Yes, I'm starting a 4-dimensional medicine or ACES model of health, or ACES Well, a podcast and a forum. I really want to bring the thought leaders and experts and advocates and the people who really seek to take care of themselves to be on the show. And so we could have the good education and discussion for the general public, because healthcare is our own business and is everybody's business, which is very different to medical care, which really requires expertise and specialists. But for the healthcare, and that's what we have to do ourselves.
And I think this understanding is really gaining momentum, and people are really beginning to realize that. So fantastic that you're supporting that with the wisdom that you have and the immense expertise you have with this, Dr. Yang. We can take a quick look at that. Perhaps we can show some clips from that now.
Literally, qi means the energy that support our lives or function physically and mentally from the air we breathe in, from the food we eat.
And also, I started we're publishing a series of articles on the Epoch Health as well for the anti-aging series.
I did see a recent Epoch Times article, Dr. Yang. I'm not sure if it's related to the anti-age series. This was kind of like a foundation article, like your origin story, your family's history, and then your own background in traditional Chinese medicine, the integration of that with Western medicine, and also it had information about the emotional freedom technique, which you were just talking about before, and some diagrams on that. This was a great article and a very interesting read. We'll put the link to that in the description below, alongside the link to the ACES medicine course you were talking about. And I just want to thank you for coming on and giving this great elucidation of the connection between mental health and energy, and how this fits into a bigger picture of our health.
Thank you for having me.
So there are many different forms of qi energy in the body, including those originating from the body's different energy centers, like the spleen, the kidneys, the liver, and the lungs. Disruptions to energy flow can bring health problems, from migraines and chronic pain to depression. Genuinely resolving illness and elevating health, however, calls for not just treating physical symptoms or even energetic symptoms, but looking at the emotional and spiritual aspects of our lives, of which the quality of how we relate to one another is key. Find the links to Dr. Yang's articles, his ACES model of health webinars, and other media in the description below. Up next, discover how the breakthrough neuro-emotional technique is being used to relieve unresolved stress and psychological trauma. The link to that video is in the comments and description below. And remember, you can subscribe to stay abreast of our Vital Signs Health Insights by clicking that big red button below. It's been great to be with you. I'm Brendon Fallon, and this is Vital Signs.